Hey, how you doing?
Alright, sorry I missed your call earlier.
Oh, you fine. I was just, I got this little video right here for my assignment, and
Okay.
basically we just gotta upload it. But like I said, I'm Kellen Blanchett. I'm here with Dr. Wilson, and I guess I'll just ask you a few questions. First, I want to ask where you work or where you live. Just kind of get a feel.
Alright, so I work for Reliant Rehabilitation. We are a contract company where we work into different nursing homes and they contract in. So we work for them pretty much. They call our company, we come in with our rehab team, and we provide rehab services to their residents.
Okay. So the first question I just want to ask, what made you get into your profession that you are in now?
I actually took a class in high school. It was an overall healthcare course where we explored different areas of different medical professions, and physical therapy was just one that I really liked just because I too was into sports and I thought it was a great move, what I thought was going to be sports medicine for me. But I decided on physical therapy, and generally it just resonated with me just because of the sports and stuff that I used to do. I just thought it was a good profession to go into.
Okay, could you explain to me like maybe the hours you work or your hours of availability?
So I'm actually a manager now. I still practice physical therapy, but I'm more on the management side. So
Okay.
my hours are flexible. As you can see, I'm working from home today.
Right.
But generally, a physical therapist works, your regular work day, 8 to 4:30. And really, in the nursing home setting, it just depends on what your residents need. You can come in early in the morning, or you can stay later in the afternoon, depending on what time your resident is up. And because we work in the geriatric field, some of them wake up really early, 6 o'clock in the morning, not to bed late, 9 o'clock. So it just depends on your patients. But generally, it's the 8 to 4:30 schedule for therapists.
Yes, ma'am. What is the greatest strength or the greatest weakness with working with the elderly population?
I say the greatest is that you do get to spend that hands-on time with them, and it's rewarding because many of them, if we don't work with them, they'll stay in their room, in their beds,
Right.
and it could lead to depression for many of them or loss of functional mobility. So, if therapy was not involved, many of them would stay in their room, in their bed. They wouldn't be able to walk, to take care of themselves like they did before. So just that reward of seeing them get up, increase their functional mobility, what they can do, what they can tolerate, seeing their endurance improve, I think that's the most rewarding. But on the other side of it, the negative, the weakness to physical therapy in the nursing homes, that sometimes you can lose that outpatient, hardcore sports medicine side of physical therapy
Yes,
with
ma'am.
working with that population because they can only tolerate so much. So I think a downside to working in the nursing home is that you lose some of the skills that you learn in school just because these are our elderly population, so you're not going to be doing the intense stretching or running on the treadmill or some of the more aggressive things you do when you think about physical therapy. It's not just working with football players now. We're working with, the elderly population, and they can only tolerate so much.
Right.
So.
Yes, ma'am. Well, I really appreciate you for taking out the time to let me interview you. This is Kellen Blanchett, Dr. Wilson. Thank you for your time.